right, so welcome everyone to the Revere Board of Health meeting. We are going to rise to salute the flag. Allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. So again, good evening and welcome to the September meeting of the Revere Board of Health. My name is Dr. Drew Bunker. I am the chair of the Board of Health. Joining me for tonight's meetings are board members Dr. Craig Costanza and Neza Luadi. Attendance for tonight's meetings are also City of Revere staff Lauren Buck, who's Director of Public Health, Michael Wells, who's Director of Municipal Inspections, Health Agent, and Paula Sepulveda, who's Board of Health Clerk. Tonight's agenda, we are first going to review and approve the minutes from the August meeting. So I'm just going to ask the other board member.
Yeah, I approve the minutes.
I approve as well.
Excellent, great, I as well. Next, we're going to do the Public Health Communicable Monthly Report with Lauren Buck.
Thank you. So just a quick thing to point out about our non-COVID communicable diseases over the last month. We've had 3 cases of influenza pop up. Again, this is a fall, winter illness, so we probably will expect these numbers to go up high. We do track influenza on a regional level with our epidemiologist, and so just a side note that we're already seeing some influenza cases. Other than that, published in JAMA Psychiatry, a study released on August 31st showed that the expansion of telehealth services during the COVID-19 pandemic was associated with individuals staying in treatment longer and reducing their risk of medically treated overdose. This is a study specifically focused on substance use patients. Just thought that was interesting that you all should be aware of. And then on Monday, September 19th, the CDC reported that more than 80% of pregnancy-related deaths were preventable, according to 2017 and 2019 data from maternal mortality review committees. The leading underlying causes of pregnancy-related death include mental health conditions, excessive bleeding, and cardiac conditions. So those were just some news reports out of the CDC this month. And then finally, our COVID monthly report. As of September 20th, we had a total confirmed and probable cases. Our total confirmed and probable cases to date are 24,946. Our daily average number of cases were 14.6. Our 14-day positivity rate was 8.64. This is a decrease. I think we can expect to see these numbers fluctuate over this next couple of months. There's more than likely going to be another fall-winter surge, although no one can really predict. And our total deceased as of September 20th was 192. That's it.
Great, thank you. Next is going to be the Inspectional Services Monthly Report. Michael Wells.
Thanks, Dr. Bunker. The Board of Health stats for Inspectional Services for this month. Another busy month at Inspectional Services. On the Interior Housing Division, we had 60 certificate of fitnesses requested for habitabilities on apartments. We had 13 re-inspections on certificate of fitnesses. We had 5 interior complaints, 1 interior complaint re-inspection, 1 pool inspection, and 1 pool re-inspection. On the food inspection department, we had 26 routine inspections, 12 re-inspections, 4 complaint inspections, 2 pre-opening inspections, 14 rodent control inspections, and 1 establishment closure for the month of September. On the Exterior Sanitation Division, we had accumulation of litter, trash, and garbage. We had 41 citations issued. Carts out at improper times, 1. 50 improper placements of trash, and 252 improper placements of garbage and trash. I'm sorry, it was 50 improper bulky items. Also, improper signage, 2 on public property. Improper storage of garbage and trash was 4. Junk heaps, dumps and automobiles, 4 violations issued. Also, for unclean, unsanitary land overgrowth, 34 violations issued and 3 unpermitted dumpsters. We also had 2 violations issued for water flow on sump pumps. And that concludes the monthly report.
Great, thank you, Michael. So next, we're going to, I think, look through or sign the proposed amendments to the regulation on restricting the sale of tobacco and vape products. So I'm going to just take a look through that. We had gone through this last meeting, yeah. Okay. So, yeah. Sign here. Yep. Okay. Yeah. Great. The other board members are going to sign the amendments. Excellent. So all set with that. Great. The last portion of this meeting will be the introduction to biosafety regulations by Lauren Buck.
Great, thank you so much. And if we can put the PowerPoint up. Thank you. Okay. So I'm going to present to the board some information about biosafety regulations. This information comes from reading through 3 other cities' current biosafety regulations in anticipation that we will be creating our own. I just wanted to give you guys some information about things that I was seeing in all of these regulations so that when you're looking through our draft, you'll be familiar with kind of the flow that other cities have used. If you can go to the next slide. Okay. Just as a review, there is a current ordinance, just a reminder, an ordinance is different than a regulation. An ordinance is what's passed by the city council, and then we act on the ordinance to make regulations. So we will be writing regulations. The current ordinance that has been going through the city council process reflects what is up on your screen right now. So the city council voted a couple of weeks ago to change some things on the existing ordinance, which I will talk about. The first was that there's a new definition for what a research and development facility is called. That definition is written word for word here below. And I'll read it. Research and development facilities means facilities including research and testing laboratories and including manufacturing associated with research and development facilities. Laboratories engaged in research, experimental, and testing activities may include but are not limited to the development of mock-ups and prototypes. Biomedical facilities defined by the National Institute of Health as Bio Level 1 or Bio Level 2 facilities, subject to applicable state and federal laws and regulations. Animal testing shall be prohibited in research and development facilities in the following zoning districts, in which use is allowed by special permit, and then it lists the zoning districts. Biomedical facilities defined by the National Institutes of Health as Bio-Level 3 and 4 facilities shall not be permitted in the city of Revere. So there's the distinction that was changed. Previously, the ordinance did allow biosafety level 3. It does not anymore. So only biosafety level 1 and 2 facilities are allowed in Revere as of a couple weeks ago. The second change was the specific Suffolk Downs zoning district that we have been all focusing on because we know that there's biomedical facilities going into that. They just clarified that, again, there is a prohibition of biosafety level 3 and 4. There is an allowance for facilities in biosafety level 1 and 2. They clarified and put into the ordinance that animal testing on the following species shall not be permitted in Suffolk Downs, which is cats, dogs, rabbits, monkeys, chimpanzees, and other related primates. And there is no special permit allowance to kind of get around those. So those are the changes that happened a couple weeks ago, which we will then obviously incorporate into the regulations we're writing. If you can go to the next slide. Okay. So there's a basic general format for most biosafety, Massachusetts municipality biosafety regulations that includes the following things. There's definitions, which all of our regulations have. There's the license application requirements. There's the Institutional Biosafety Committee and Governance section. There's a section that relates to inspections. There's a section that relates to the cost of subject matter experts, which I'll talk about later. There's the medical surveillance program in most of these regulations, which defines the fact that all of these institutions need to have their own medical surveillance program. There's the additional reporting requirements, some exceptions that some of the regulations have, and then violations and penalties. So we'll talk about each one. If you can go to the next slide. Okay, this is a big slide, sorry, just bear with me. So for the license application that the institutions, and remember, so the institution, the organization that will be utilizing the buildings that are being built in Suffolk Downs will be applying to us for this license, okay? So any type of biomedical company that wants to go into Suffolk Downs will have to do all these things when they're put into our regulations. They'll have to identify basic administrative information, you know, addresses, phone numbers, point of contacts, all that kind of stuff. They'll have to have a designated official from the organization that is responsible for submission and communication with us. Sometimes this is called a biosafety officer, sometimes it's called a principal investigator, basically just the point of contact for their organization and us. They're going to also have to provide a summary of the recombinant DNA or the biological agents that are being used in their facility and that they plan to do research on, basically a project summary. And then if any of these change, they'll have to resubmit for any new kind of research that they decide to do. They will also need to provide their biosafety level designation and risk assessment that is completed by their institutional biosafety committee. So important distinction here. We do not have to determine what their biosafety level is. They tell us based on the guidelines of the NIH and their own internal institutional committee. They also have to provide a roster of names who is on their institutional biosafety committee. I'll just call it an IBC from here on out. They have to provide us a copy of their biosafety manual that has to be approved by us prior to them starting any work. The biosafety manual is kind of, from what I'm getting from the regulations, this is kind of the big document that includes the table of all the organisms they're working with, the source of the organisms, the cell lines, the strain verification, decontamination procedures, kind of like their manual for how they are going to be abiding by the NIH guidelines. They also have to provide a floor copy and emergency plan, which will need to be approved by the public safety, including fire and police, prior to work. This is to make sure that the fire and police are comfortable with responding to any events on their property. Keep in mind that if there's a fire, the Revere Fire still has to respond, and they have to understand what those firefighters have to do to make sure that they're protected from the contaminants while they're dealing with the fire, or substitute fire in for anything, you know, sprinkler system issues, all that kind of stuff. They also have to provide a copy of the treatment or management of the waste and pest control. There's a specific regulation regarding hazardous waste, which I've listed, and that will have to be approved by DPW or the inspectional department. A copy of the training manual for all of their laboratory staff on how they're making sure that their laboratory staff are abiding by appropriate safety mechanisms, a copy of their medical servants kind of program protocols, which would have to be approved by us, and then there's obviously the fee and the yearly renewal. Next slide, please. Okay, so let's talk about the IBC. So we're first going to talk about what most of the regulations have written about the guidelines and the requirements for an IBC. So first of all, we are not the only thing governing these bodies and these organizations and doing biomedical research, all that stuff. The National Institute of Health has guidelines that organizations have to follow as well. So we will make sure to stipulate in our regulations that doesn't matter if you're getting funding from the NIH, like you need to follow these guidance documents as well. There's also something called a BMBL, which is a biosafety. It's a document, like a manual to look through. It's called Biosafety and Microbiological and Biomedical Laboratories, which many of the regulations make sure to point out that these IBC should be following. So in most of the regulations from other cities, there's a couple of requirements for who needs to be on the IBC. Some of them state it needs to be a Board of Health member, i.e. the chair of the board. Some of them want a municipal staff member, i.e. like the director of public health. That's something that we could potentially talk about, who we all want to be a requirement for all of these committees. There's also in every guidance, in every other city's regulations, and I believe this is in the NIH guidelines, there needs to be a community representation, meaning that they need to find a community member, someone who represents the community of Revere, to sit on these committees as well. So that would be the community representation piece. It's important that we'll put in our regulations, and this is in all the other regulations that I've read through, that none of the people that are that the Board of Health appointee, that the community appointee doesn't have any financial interest in the company. And then also just to make sure that we'll put in that the representation of the community member, the Board of Health member, those people, have to abide by non-disclosure and non-use of proprietary information and trade secrets. Again, these are all organizations that are working on potentially, private information that we would all, have to make sure that we're not sharing to the world. They're required to meet no less than once a year in all the other regulations that I read through, and all meeting minutes are required to be forwarded to the Board of Health and reviewed by us upon receipt. Okay, next slide. Okay, so that was kind of the requirements of what they do internally and how they're formed. In terms of their reporting out to us, from what I can glean from the other regulations, they are responsible for completing the biosafety level designation and risk assessment. They are responsible for reviewing and approving all project summaries. They're responsible for approving the institution's biosafety manual, approving the emergency plan, approving the training manual for laboratory staff, the medical surveillance program, and waste management plan. Just basically that the IBC will be reviewing all the things that have to be submitted to us and kind of like agreeing that the committee thinks that they're all appropriate, and then we'll be submitting them to us. Next slide, please. Okay, so there's a couple of different ways that the other municipalities have talked about inspections. Most of them say that we need written authorization to allow inspection of facilities and records by the Board of Health or its agent, or an independent consultant retained by the Board of Health. Some mention that we would be required to make a reasonable notice amount of time, and some specify that we could make an unannounced visit at the board's discretion. So there's a couple of differing kind of regulations that we could potentially, go either way. Obviously, we need to make sure there's confidentiality by all inspectors on, again, the proprietary information that's released to them. And then some regulations had written in that there would be a final inspection if and when a facility closes to make sure that they've properly decontaminated and made sure that they closed up appropriately. Next slide. Okay, so here's where almost all of the regulations talk about the fact that recognizing that none of us are experts in biological safety as boards of health, and therefore we will hopefully write into our regulations that we always have the ability to have a subject matter expert, and the cost of that subject matter expert would be associated with the organization, meaning they would have to pay for the cost of the subject matter expert in case we were having some, concerns about what we were seeing. If we wanted to make sure we felt comfortable with what we were seeing, this might be something where we use this for the first go round, and then you might be comfortable. But most of the regulations state that the cost would have to be by the organization. Some regulations asked the organizations to submit a certain amount of money on the application to be held kind of like an escrow for us to use if we needed to pull out from it to use from this. So that's just some things that we could consider talking about in our regulations. Next slide. Okay. Most of the regulations also required organizations to engage a reputable clinical organization to establish a medical surveillance program. Basically, they need their own medical staff to review their they need their own medical program to review their own staff. This would include coverage of illness with symptoms consistent with any infectious or potentially infectious biological agents that are being handled by the institution, any animal bites that come up, again, potentially some animal research might happen here. They would have to obviously have record keeping that's compliant with HIPAA. And one of the guidelines specifically mentioned that they need an occupational health physician as part of their medical surveillance program. And then obviously we want to make sure that they're reporting back to us within a certain amount of time if there were any issues that the medical surveillance program identified. Okay, next slide. Just some final reporting requirements. We would have to specify the amount of time that we would want to be notified when there was ever a release of potentially infectious material or any adverse events. This time's really differed depending on the regulations that you read through. And then an amount of time where they would have to provide us the meeting minutes of the IBC for review. Again, this differed based on the regulation that I was reading. Next slide. Okay. One of the reason that I put this slide in, one of the regulations, I forget which city, I reviewed, I believe Beverly, Peabody, and Bedford, but there are many out there. Cambridge has them. They've just been around for much longer, and they kind of use a different process where they have this whole other committee that the Board of Health doesn't necessarily deal with this. It's like a whole different committee, and I think the best way to go for us is to have the Board of Health handle this, just a side note, but. Okay, so the reason that I mention this is there was one specific regulation where they specifically chose to write into their regulations that there was an exception that includes clinical or healthcare services or professional analytic services that directly support a clinical or healthcare services. I want to just point out that there is a current, so this is what we're talking about when there's laboratories at primary care offices. Those have biosafety levels associated with them as well, and they're working with bloodborne pathogens because they're drawing blood and stuff like that. So we would have to decide if we want to make an exception where they don't have to go through the process of licensing with us because they're associated with a healthcare facility. I bring this up because it is in other regulations, so I don't believe this would be completely unique to us, but it's just something to think about because we have multiple primary care offices here in Revere who have labs. Okay, next slide. The next slide is just basically talking about how, we always have the right to revoke a permit or license if an institution fails to comply with regulations. There were differing levels of fines for violations. Some were 200, 500, 1,000, depending on the regulation that I was writing. That's also something we'll have to consider what's an appropriate fine for violations, differed in every city. And the next slide. And then just for some final stuff, again, some mentioned specific regulations around what an organization would have to do if the facility was closing, i.e. allow for inspectors. And then one kind of interesting thing that I read in one regulation was that like in Bedford, they specified that there was going to be a total maximum amount of liters of live culture allowed in any institution. That was the only regulation that I read, of the three that I read, that specifically called that out. So just other things to keep in mind. But that's a review of kind of what we're heading towards in the next couple of months. And then the next steps for you all, just to know, is that we will be drafting some regulations with the assistance of the city solicitor, obviously, who helps write all these regulations for us. And then we will present them, and to you, changes can be made. A public hearing has to be had for the regulations. Whatever changes happen from that, we will give you the revision, and then you can look at the revision if we need to make changes from that, or if we can sign it, just like the other regulations we've done so far. That's my review. Thank you.
Great, thank you, Lauren. So that's going to conclude the meeting for today and this month. Thank you.